Welcome to our program called Selalelo. I have on the program with us Maripela Letabele, also known as Shana, and she's going to talk about issues related to maternal health in Botswana and some of the experiences that people experience, I think, through other African countries. My first question for you is, what is Selalelo?
Selalelo is a program that seeks to connect Southern Africans and the rest of the world, especially to form friendships and collaborate on issues of international importance to people of color. And we are based in Botswana, in Southern Africa. So we have different types of forums where we discuss issues that are of importance to Southern Africans and their relationships with other Black people everywhere else in the world.
What is it like for maternal health in Botswana and particularly in Southern Africa or in African countries in general?
As you know, Botswana and other African countries are part of the United Nations, where there are international guidelines on how maternal health and care should be handled and maintained in all the different countries of the world. And all the African countries, the majority of them are signatories to all these international instruments that ensure good maternal health and care for women in all the various countries. So we find that a lot of African countries struggle with things like maternal death, child mortality, and all these kind of things at varying rates. At different times, different countries are doing well in one area of maternal health spectrum. Others are doing better or poorly in others. So in Botswana, I think we are doing pretty good. Some years ago, we came from a very devastating HIV crisis that led to high mortality rates for both mothers and their infant children or newborn children. And we have made strides in recent times, but we still have other problems that are still associated with maternal health, like women dying during childbirth and children dying at birth or before their fifth birthdays. So I think we're doing pretty okay, but there are some things that are still lagging behind in terms of the facilities where women give birth in mostly government hospitals.
What is it like women go through when they're dealing with the whole issue of childbirth and maternal health issues in your region?
Well, as we'll see at the end of this interview, women in Botswana are having a very difficult time during their maternity experiences, because in Botswana we have universal healthcare, which means that healthcare is virtually free in government hospitals, which means a woman giving birth doesn't have to pay anything from prenatal care till postnatal care. However, every now and then there surfaces issues of women who have had horrible birthing experiences. And in May of this year, we had a young woman whose video I'll share, has one of the worst birthing experiences that anybody can imagine, where she had to give birth by herself because of the neglect of the nursing staff in the maternity ward of the primary government hospital in Botswana. So you might find that some women have okay births, others have the most horrendous birthing experiences. Like, I am also a victim of how I accessed healthcare at the government hospital, and it was totally horrendous. And that was 24 years ago. So it's kind of sad to see that very little has changed since then.
What can the average person do to help in this situation? How can they support your cause? What are your goals?
Basically, what we're trying to do now is to try to start up a petition and an advocacy for better healthcare in Botswana. And by so doing, we know that it might inspire other women in other African countries who are going through the same thing. When you have free healthcare, obviously only the bare minimum is being made available for the women. And we think that there's a lot that can be done. And through this petition and our advocacy efforts, we are hoping that we can rally women from every corner of the world to support us, because we need to come together. And Botswana is one of those countries that are a little tricky, because it's easy for anything to become politicized. And if you are in any way seen as somebody coming from a political point of view, even though you are advocating for women, you may be silenced in different ways. So we think that with international support, we can actually show the government that there's nothing political. We're just women trying to get services for, in other countries, people have to pay to give birth, but in Botswana, it's free. So it's almost like, just because it's free, it is the worst standards that you can imagine.
When we deal with prenatal care in the United States, when they determine that a woman is pregnant or expecting a child, they start to provide the supplemental tablets and vitamins and so on, prenatal pills and so on, when do they provide prenatal and support to kids or mom before the baby's born in your country with your free and universal health care?
Yes, yes, they do everything. If you have to go for a C-section, everything is taken care of and you don't have to pay anything. But you'll find that the facilities are filthy, it's just dirty. The midwives in hospitals are very rude. It's just a horrible experience to give birth in a government hospital in Botswana. It should be better.
Do they have a complaint process, evaluation process about the birthing process, and a visiting nurse who may come out to the mother after the baby is born to visit them in their homes or villages or their locations?
Like I said, everything is bare minimum. You can complain, but it never goes anywhere. And it keeps on cropping up every now and then.
How many years would you say this has been occurring in your region, in your country?
I had the misfortune of giving birth to my daughter in a government hospital 24 years ago. And the things that young people are crying about today in 2024 are the same exact things that have happened to me 24 years ago, which shows that virtually nothing has changed. So I think it has been going on for much longer. It's just that women in my country are happy to get the free service and they're not going to say anything about it. Even if they did, nothing will change, it looks like.
In the United States, there are standards that are set up by national medical associations, nursing associations, and so on, and different kind of protocols that people have to provide. Are you aware if there are certain protocols that are provided by the government or some international or national entity to help correct some of these anomalies or these problems that you're describing?
Obviously, they must exist, even though we don't have access to them. The other thing, like I said, was as a member of the international community, Botswana is also part of the United Nations. And we know that the Botswana government will do anything to tick all the right boxes in all of the United Nations requirements, even in this particular case of maternal care. But they do the most bare minimum you can imagine. If they say that a woman who's in hospital should be provided with a meal, for instance, they will give you a meal, but it will be of the worst kind that you can imagine. So you're supposed to be grateful just because a meal has been provided to you. You get what I'm saying? So it's not
Yeah.
like they don't do anything, they do, but it is like the worst kind that you can get. I suppose there's a burden on the health facilities themselves or the government's budget, just because there are so many people to care for and they don't have to pay anything. Which
Shauna, the other question I have for you is that sometimes international pressures from other countries, and again, women from other organizations, like in Omaha, we have the Women's Fund, we have a Center for Advancement, other women's organizations, and of course, there are many progressive men organizations that will support the healthy birth of a child anywhere. Uh, are we in the United States put pressure or write a letter or correspond or write or call someone on the national or international level to help improve the quality of health care for women who are providing birth in that region?
I believe any form of help would be appreciated by the women, but because we're talking about government departments, it's always better. There's a protocol to be followed on how governments or organizations reach out to others. There are a few women's groups in Botswana, and I'm sure they would be willing to partner. I think the more voices that can be heard, the better it will be for everybody concerned. When there's an injustice happening anywhere in the world, I think anybody who can stand behind any group of marginalized people will be doing good service to humanity.
The other point you alluded to earlier in the interview, you said something like there are sometimes repercussions for women or people who speak out in certain regions or country. Will any of these people who are participants in this conversation or this video or whatever have any pushback from government folks, particularly when the government has not fulfilled the basic requirement of helping the birth of a child, a newborn?
I hope not. And I think the women who are in the videos that follow did it on their own volition. They were not coerced by anybody. And we're just hoping that we will be able to amass as many testimonies from other women so that the government can see that it is a problem. Because if it's only a few people, then they can be easily singled out and ostracized. But if there's a whole lot of us, I'm sure we'll be able to do it. So the kind of help that we need is a way for people to fund us so that we can reach all the women in all corners of Botswana, so that we can have 1,000 videos, for instance, little vignettes of people telling their experiences, so that the government can see that there's a national problem. It is not just those two women who are speaking.
If someone wanted to contact you, how would they do so? What is your best contact information? Through your email system, through your international mailing address, or through your Omaha-based MORE group, or all of the
Yeah.
above?
If it's an international audience, I think it would be better for them to contact us through MORE, because MORE is our steward. They help us in a lot of things that we don't understand. But otherwise, people can reach me at merapelo.letebele@icloud.com. I will type the email for everybody to see, because there's a desperate situation, and I think the more people help us, the better, in whatever form.
Good. You had alluded to earlier that you were going to start an online petition. How will that take place?
Well, our petition will be two-pronged. First of all, we want to invite all the women who have had all these experiences to reach out to us so that we can record them. We can travel to where they are, take videos of them, and then we make a huge compilation. And when we have all the compiled testimonies of the women, that's when we will get into the second step of sending it to relevant authorities and government to show them the experiences of Botswana women. And we think that it should not be a once-off thing where people sign their names and attach their signatures to a petition and that's it. We want a follow-through. We want change in policy.
One of the questions I regret to ask or did not ask and thought about it as we were talking is, what is the age range of the participants or the women who are involved in this whole issue that you're working on? What are the general age range?
The two women that I interviewed, one of them was a first-time mother who's like 23 years old, and another one is a little older. But you see, all women of all childbearing age have been affected by this, as long as they've given birth to a government hospital where there's just dismal care and concern and regard. All women of all childbearing ages.
One question that comes to mind is, again, many of these women do not know each other, I suspect. Is there a plan at some point to bring them together to have a coercive, I would say a comprehensive or some kind of a table talk conversation so they can share their notes in a collective fashion? Are you dealing with them only on an individual basis at this time?
Well, the way I've been doing it was I was targeting all the women that I saw commenting on the topic, because back in May, a young woman came out to tell her story, and all these women were like, the same thing happened to me, the same thing happened to me. So I personally reached out to the women, spoke to them on the phone, the majority of them. Some of them were hesitant to come to the fore, some of them were open, and I was visiting them in their homes so that I could see. Some of them were willing to talk to me, but they didn't want to be recorded because of I suppose, the backlash that they feared. So it's all types of situations. And as you may or may not know, Botswana is like, it has a huge landmass, so which means you might find somebody who's 1,000 kilometers from you willing to talk, and another one right next door to you. So it's all types.
And as we kind of close down this clip and so on, I want to give you an opportunity to maybe answer one or two questions and so on. What is your ultimate goals in terms of the success of your program? What do you see as a great success of your program if you achieve your objectives?
I think for me to gauge whether our efforts have been successful would be for me to have at least 500 women on video telling their story, and us compiling all the videos and sending them to the Ministry of Health so that they can see. I might just say, please give me the little leeway to say, we've had a few women ministers for health in the past, but because we come from a patriarchal society, men don't see these things. That's why it's easy for them to get away with just ticking the boxes of the bare minimum that the United Nations requires. They don't really see it as a problem. And I feel like if our stories come out there in the open more, a lot of them come out, they can see that, no, definitely there's a crisis situation, because it is a crisis situation. But they think that it's just one odd woman or one unhappy woman who had a bad experience.
One of the things that come to mind is that obviously to have children, it takes two people, and it takes a man and a woman. Do you envision at some point men being a part of your movement and helping support? Because again, fathers are equally as important as mothers in terms of helping to nurture and raise a child. So is there room at the table for the other gender to be helping as advocates in this important cause that you're talking about?
The one half of the table, the other side of the table is open for men, because we are all about building better societies, and societies are made of men and women. So we want them to help us to be our advocates and do whatever it takes so that we can overcome together, because they are the fathers, we are the mothers. Maybe the mothers are the only ones who have experienced the pain and the bad service, but they should be right alongside us, asking for this change, the much needed change, because this is a crisis situation.
I have one curious question before I get off the video here, and I just find this very interesting because at the time when my 4 children was born, I was in the hospital birthing room with them. Does that happen in your country where men are in the birthing room, or is it the mother-in-laws, the mothers, and so on, or the sisters? Who's in those birthing room when the child gives birth in the government or private hospital?
I think it depends on who's assisting you at the time of your birth. Some of them, they are lenient. They might agree to it, but generally, because we come from a very traditional background, they think that it is improper for men to be in the birthing room. But I think I've heard some men say they were allowed even in the government hospitals, but it's an exception to the rule. But in private hospitals, obviously, it's a different story.
Well,
So
the reason I mentioned that is because I know each one of my child when they were born, they came out and they waved at me. A couple of them spoke to me in the language, and but they were very engaging. I know they all came out with a full head of hair, so we had to comb their hair upon birth. But it was a wonderful, powerful experience, and even the most powerful ones when I had 2 boys and then I turned around and had a girl. So I was very happy and screaming and hollering because I know that we need a girl in our family to have balance, but it was very important. So I just encourage people to continue to go and see when the child comes out and see if the child can speak to you in whatever language the child is socialized in. So I hope you
that's what
enjoyed this, and we'll talk to you later.
we want that for ourselves as well as we Botswana women. Thank you.
And thank you for participating in this program, and hope we will bring some more information from this program with Selalelo to talk about maternal and child health on an international level.
My name is Ashley Ngwe, 35 years old, mother of 2. I had a bad experience go Lisirani Clinic when I wanted to register my second pregnancy, the ANC. For a period of about 12 weeks, I kept going to the clinic every day and I would return. So you can imagine being a corporate lady, requesting for a bit of time off on a daily basis, how then it reflects to you as an employee. So I would get there every morning, whether I get there at 5 a.m., 6 a.m., 7 a.m., no difference. The midwives could only assist about 4 people every day. By 12 o'clock, they disperse and say they are done for the day. So I kept going there every single day for about 12 weeks. So on the
What year was this?
23rd of August 2020.
Okay.
I was really frustrated that day. So at the time, Dr. L. Kwape was still the Minister of Health. I sent him a message on Facebook, on the messenger. I just outlaid my frustrations about the service that I got at the clinic. And then the next day in the morning, he responded to my message. That very same day, I got a call from the DHMT Greater Gaborone about my complaint. They noted that I made a complaint to the minister. And then I think she then relayed the message to the matron of the clinic, Lisirani. They called me. That is only when I was able to register. Now, I could imagine somebody who does not even have a smartphone, to be able to make the move that I made. What more of them? Or somebody who works a job that is really, really tight. You can't be taking time off on a daily basis. Sometimes it goes just a long way. Your employer may be understanding, but what about somebody else? That's what I thought of. The ladies that I used to go there with for checkups or trying to make a registration, I could then wonder how much frustration are they going through. So from there, because I was known as this girl that reported to the minister, I always then the DHMT Gaborone called me to get my story. And then I later also got a call from the matron, the Lisirani clinic as well. That is only when I was able to get help. I sat there and wondered, we really have a very substandard health system. And you can imagine some other people who were not able to go to the lengths that I went to. So post that is only when I started getting very good treatment, because I was now labeled as this girl that reaches out to the minister, who reports to the minister. But it shouldn't really be about who do you know, what can you do, what have you done for you to be able to get good service.
My name is Angela Trobatsky. I would like to just talk about my experiences delivering my kids at the government hospitals in Botswana. I am a citizen of Botswana, and both my kids I've delivered in the government hospitals here. I've had 2 children, one in 2016 and one in 2023. My first child, I gave birth at Princess Marina Hospital, and my second child at Pamalete Lutheran Hospital in Ramotswana. My experiences with the midwives don't just start at the time that I delivered my first child at Marina. It started at my prenatal visits at the local clinic near my house. I had gone to BH3 clinic, it was nearest to my house, and there was a lot of arrogance and pompous attitude from the midwives there. It was quite traumatic. I mean, straight from the beginning with our pelvic exams, it was my very first time to have that. I'd never had a pelvic exam before in my life. I didn't know what to expect. I didn't know what tools were being used. And the midwife scolded me in a humorous manner that I shouldn't be scared of a speculum because I'm going to get cut with big scissors anyway when I give birth. How can I be scared of a speculum? I was very young, I was 21 years old, and I didn't know what was going on. I didn't know what to expect, but I just soldiered on and I just took it as it came. And when it came time to give birth, my experience, it was 2 days of labor. I went into labor on a Monday, my waters broke. It was a very long day. It was a very long day of tremendous pain. I was in so much pain and I didn't understand why. I was in so much pain. Luckily, at that time in 2016, my mother and my best friend, they stayed the entire time. Although visiting hours, when those ended, they would wait outside for me. They slept outside on the bench, waiting for me. I was not dilating. There was no update from the nurse on duty to tell me why I'm not dilating, why am I in so much pain. I remember I had a runny stomach and I asked the nurse, please, I need to go to the toilet. And all she said to me was, make sure you don't give birth on the toilet, that's all. No one assisted me. After several hours of no progress, every time I would be in so much pain, constant contractions, I'd ask the nurse, please check me to see how far I am. I would get scolded for being told, like, you're still far, you're only 1 centimeter dilated, you're wasting consumables. Every time I check you, I have to get new gloves and new sheet, the disposable sheet protectors, basically complaining that I'm complaining. It was an elderly Jamaican nurse at the time that was in the wards, and my mom really pushed. She tried her very best to make me comfortable. She would come with hot water to try and massage my back. At some point, the pain was too much and I was not dilating at all. And I was very fortunate that a family member of mine knew one of the doctors who worked there and asked him to please come and check on his sister. And the doctor did come to check on me. And as he did check on me, he did it's called, I think, a cervical sweep to try and stretch my cervix to stimulate dilation. The very same nurse was complaining that why am I getting special treatment and that we are wasting consumables because the doctor has to use gloves and more bed savers, disposable bed savers. I was very fortunate at that point that the doctor gave me some pain medication. I was able to sleep for about 45 minutes. From there, I think I was about 6 centimeters when I woke up. It was around 11 a.m. the next day. I was ready to go to the delivery room. At the delivery room, I did sense some, I don't know if I should call it attitude from the nurses at the building, because I was still drowsy from the pain medication and I was in a wheelchair, and they're like, yeah, oh, she got pethidine, oh, whatever. And I felt like I'm now an inconvenience to the nurses because of the state that I was in. I was wheeled into the delivery room. my mom came through, and luckily at the time, my employer also came through. She was a close friend of mine, and even though she was not allowed in, she insisted she's coming in. Giving birth, from the beginning, I could feel pressure. I could feel that, there's pushing happening, and the nurse was shouting, "Don't push, you're not ready, you're only 9 centimeters." And I'm like, I'm not pushing. It's happening on its own. And my mom tried to calm me down. I held her hand and squeezed, and I said, "Mom, I'm not pushing. I promise you, I'm not pushing." The nurse ran out to go and get ready to collect her, I would call it a delivery kit, the tools that come sterilized and wrapped in a blanket. And she came in and she's like, "Okay, you're ready to push?" And I don't know how long that happened for, but I was instructed to lay on my back and hold my ankles and pull them back. And I could not even reach my ankles because my stomach was so big. I couldn't. So luckily my mom and the lady held my ankles for me, and I pushed, and I followed the midwife's instructions. It was so hot that day. The midwife was sweating. I could see the drops of sweat dripping onto me, and she would wipe the sweat off from her face, which I don't think is sanitary. But anyway, my mom did tell me afterwards that the midwife did use a tool, I guess a vacuum or a suction. My son does have a misshapen head at the back. My mom says that the midwife did use that to try and pull the baby out, of which I was not told of that during my labor. I was not notified of what was happening or what was being done to me. The midwife at some point told me that...
Were you alert the whole time?
I was alert. The midwife told me, "Listen here, the baby's crowning and you're taking too long to push the baby out." Being told like, if you don't push now, your baby's gonna die and it's your fault. Those kind of words, they stick with you for years, forever. Those kind of words will stick with you forever. And she tells me, "Listen here, I'm gonna have to cut you. I'm gonna have to give you an episiotomy." So I'm like, "Okay, it's fine, go ahead, let's get this done. If that's what you need to do, do it." And she got out the scissors to do the episiotomy. And that was one of the most painful parts of my delivery with my first child, because the scissors were blunt. So basically all she did was pinch me. And she told me, "Oh no, the scissors are blunt, I have to go and get a new kit."
Wait, she didn't give you a little shot?
No.
Wow, I remember getting one and me getting a little shot, and the numbness kept on running out.
Maybe she did without telling me, because a lot of things happened without her narrating what she's about to do. So I don't know, maybe she did give me an injection before, but it was so painful that my friend who was outside in the waiting room said she heard me scream at that point, and she was so nervous because she did not hear a baby cry after that. Little did she know that I was still far from delivering. The nurse rushed out to get a new kit. She unwrapped it, got another pair of scissors, and she said, "Okay, I'm going to try again." And I'm like, "Okay, cool, go ahead." And that time, indeed, she managed to do the episiotomy. And I pushed again, and when the baby came out, he was gray. And my mom says that the cord was around his neck, and the midwife quickly took it off. At that point, luckily, the midwife put the baby on my belly, and he was breathing, but there was no crying. It was very low. You could tell that the baby was exhausted or something. He was not pink, he was quite gray. She finished off, I had to deliver the placenta. The stitching part, she did give me numbing injections, so that was fine. She was quite fast with that. Then she took the baby away, to go and weigh him and do the APGAR scores, of which on the report showed very nice, high, beautiful scores of 8 and 9, which I found weird because when the baby came out, he was quite gray and weak. I didn't expect the first APGAR score to be so high. So I feel they
falsified.
I think that's falsified APGAR scores. But other than that, after I got stitched up, I got to go back to the ward for recovery. But it was so full. Mattresses were lined up to the door.
On the corridor?
On the corridor. All the beds were full. The mattresses in the corridors of the entire ward were up to each exit on opposite ends. So there was no space for another person's mattress to go down. At that point, the matron came in and she said that she would try and transfer some of us to our respective prenatal clinics so that we can spend the 2 days recovery there to make space. Which, okay, yes, what can I do? One of the things that also till today I'll never forget, the lady on the mattress next to me lost her child in labor, and so she was on her mattress next to me, literally a meter away from me and my baby, and she was just staring at me. I didn't even have the guts to ask her, "Where's your baby?" But she did mention she lost her baby in labor. And in my mind, I asked myself, why is she in recovery in a ward full of ladies with their babies? Why is she not some sensitivity to her situation? Why is she not at least in a different ward, a gynae ward or female medical ward? Just some compassion for her situation. The state of the wards, the bathrooms, the toilets, filthy, unsanitary, overflowing pads in the bins. Out of the few toilets that are there, you would find that most of them are out of order. The other ward, the ceiling boards had fallen, cables were hanging out, taps were leaking. I remember when I left, I had actually reached out to Consumer Watchdog on Facebook to say, like, this is not okay. Who can we reach out to for just simple maintenance to be done on the hospital? And he's like, this is a government institution. There's not much that can be done. The government has to be the ones to say that, yes, we're going to go and renovate, we're going to maintain. Anyway, I went home and my baby is okay.